Hello, my name is Katie Murphy and I have the honor of being the president of the Massachusetts Nurses Association. Thank you so much for offering to participate in the MNA's virtual lobby days this July. A lot of important issues that affect our practice will be decided by the legislature before the end of this month, and we want to make sure that they hear from you. At this point in the legislative session, the issues that our legislators are focused on have really narrowed, as they only have a short time before they go on recess. This makes this the perfect time for you to weigh in as nurses, healthcare professionals, and constituents. We are asking that on Wednesday, July 17th and Wednesday, July 24th, you take just 5 minutes of your day to call your elected senator and your elected representative to tell them the time to act on comprehensive workplace violence prevention legislation is now. The MNA has filed legislation that would require annual safety assessments at healthcare facilities, provide paid time off to address assaults that happen at work, collect information on workplace violence at healthcare facilities, and impose penalties on healthcare facilities that do not comply. In this email, you've been provided with a script as well as a link where you can look up your state representative and his or her phone number. Once you have this information, you should call the office of your state representative. You will likely talk to a member of the legislator's staff. First, identify yourself as a constituent, someone living and voting in the district, and provide your voting address. Then, tell them what you do and where you work. For example, I would say, I'm an ICU nurse at Brigham and Women's Hospital. After that, tell them you want the legislature to pass comprehensive, meaningful, measurable, and enforceable workplace violence prevention legislation by the end of this session. You can reference the bill numbers in the email script. Share any personal experiences you have related to workplace violence and how it has affected you, your colleagues, and your workplace. And then thank them for their time and offer to be a resource on this issue going forward. If the staff member asks you any questions, you may answer them, but if there's anything you can't answer, especially as it pertains to the legislation, you can direct them to the MNA. It is not your job to be an expert on legislation. You are an expert on being a nurse or healthcare professional. So thank you again, and please take the time to make these important phone calls to advocate for yourselves, your colleagues, and your practice.